This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubaida Hamid, your host for today. Earlier this week, the United States recorded its first death due to measles after over 10 years. Why is this significant? The US had declared the eradication of measles, a highly infectious viral disease, from its country in the year 2000. Over 150 people, mostly children, are currently ill in Texas, and the outbreak has now spread to other states as per US news reports. In Texas, all but 5 cases were in people who were unvaccinated or whose vaccination status was unknown. The country's health secretary, Robert F. Kennedy Jr., who has a history of debunking vaccines, has now said that vaccines protect individual children and the community as a whole. Why is one of the most vaccine-preventable diseases surging in a developed country? Is vaccine misinformation becoming a serious public health crisis? What is the situation in India like, and what is the situation in other countries? We dive into these questions and more with Dr. Rajiv Dasgupta, a community health professor at Jawaharlal Nehru University, New Delhi. Hi and welcome to the Hindus in Focus podcast, Dr. Rajiv Dasgupta.
Hello, good morning, and thank you very much for the invitation.
Doctor, most people think of measles as a mild childhood illness that can be dealt with fairly easily. But in some cases, it can result in severe complications. Could you tell us a little bit about the virus and the disease?
Yeah, measles is a common infectious disease among children, and particularly younger children. Of course, for most children, like most viral illnesses, it's a relatively minor disease in the sense that there's a little bit of fever, there's some rash, there can be some rash, and maybe a bit of a running nose, which sounds quite like a common cold episode. However, in younger children, particularly less than 5 years old, serious complications may and does occur with people, and they may result in death. And that really is the big risk from measles. Also, the other thing to keep in mind is that measles is one disease which is extremely contiguous, even among common infections. So, what's called a secondary attack rate, which means that if you have 100 children, let's say, in a class, unless otherwise protected, which is through immunization most commonly, or an earlier infection, up to 90% can be expected to get infected. So this contiguousness plus mortality in case of complications makes measles a pretty serious entity in public health terms.
Thanks, Doctor. The US is now battling an outbreak of measles with at least one reported death so far in a child. There's very little known about it, but we know that it was a child. After having eliminated measles from their country in the year 2000. Could you explain to us what is behind the current surge in cases?
Yep. The US situation is a little complicated. At the same time, it's instructive. So, this is the first measles death in the US in the last 10 years almost. And this, however, is not so unexpected if one looks back at what's been happening in the last few years. And that is as follows. Over the last few years, the vaccination rate has generally been declining somewhat. And cases have been on the rise. And there are two components to it. One, that many of these cases were among were imported cases among visitor populations or immigrant populations. However, roughly between 2000 and 2015, it never went up on an average of about 200 cases a year. In fact, it largely stayed below 200. In 2019, it crossed 1,200 cases because of travel related issues. But this time, what's happening is that it's being reported from across the states of the USA. And the key reason is that vaccination rates have actually been falling, declining. So if you talk of Texas, where most of the cases has been in a cluster of school-going children or a cluster of communities in Western Texas, on the one hand, Texas actually has reasonably high measles vaccine coverage of about 94.3%. And at the other end, if you see states like, say, Idaho, it's about 79.6%. And then if you see California, it's about 96%, and New York about nearly 98%, and so on. So there's a lot of variation within the United States. But what happens, and in measles, this is a very important context to understand. In measles, though one may have or one may achieve reasonably high coverage with measles vaccine, yet small unimmunized or underimmunized populations of children are very prone to focal outbreaks. And if there are focal outbreaks, there are going to be complications and potentially deaths. And this is very true of India also. Though India has pretty high coverage, measles cases have been on the decline, certainly. We can talk about it later, but there are, and this happens particularly in urban or peri-urban settings, if there's a group of unimmunized or underimmunized children who are recent migrants, then that it's liable to outbreaks and even deaths. But what's very clear now from the Texas situation, and it's also true of several other states in the USA, that measles vaccination coverage among the US kindergarteners has dropped in recent years. So in Texas, this was 95% in 2019-20 school year, which is down to 92.7% in 23-24. Now, on the face of it, this may be hardly 3 percentage points, but because you have these pockets of unimmunized children, they're extremely liable to outbreaks. And measles outbreaks are very explosive because remember, the secondary attack rate is very high. But when you break down further in Texas, Gaines County, which has been pretty badly affected, about 20% children were unimmunized. And in some school districts, even half the students were unimmunized before the current outbreak. Of course, they're doing catch-up vaccination and so on. So if one really digs into the local or the micro situation, there are these pockets which are vulnerable to outbreaks. And that's what's exactly happening in the US broadly, but certainly in Texas in specific.
So, you would attribute their entire surge and the outbreaks that they're facing primarily due to unvaccination and undervaccination?
That's what the epidemiological assessment in both the US, as one can see from the CDC position, as well as more detailed reports from Texas indicate.
Tell us a little bit about the immunization itself, doctor. What is the measles vaccine? How long have we known about it? And what is the protection that it offers?
The measles vaccine is actually, fortunately, one of the most effective vaccines. The vaccine is both safe and it's very effective. It's actually far more effective compared to several other common vaccines. So even one dose is about 93% effective, two doses are about 97% effective. And therefore, with a good vaccination program, measles cases do come down rapidly. And therefore, this has been one of the diseases which has seen reasonably successful elimination campaigns and reaching the elimination target. So, of course, this is done in combination with, it can be done in combination with varicella and mumps and so on, but those are combination vaccines. We are not talking of that. But per se, measles vaccines are extremely effective, and that's been at the success of that explains the success of gaining a handle of measles widely across the world, and certainly in the US or the American continent as a whole.
Tell us a little bit about the US Health Secretary's stand on this. The Robert F. Kennedy Jr. has had a history of dismantling trust in vaccines, and there seems to be a lot of mistrust, a lot of misinformation about the fact that about people believing that the measles vaccine can cause autism or other disorders, despite multiple studies finding no evidence of this. What is the situation with regard to distrust in vaccinations in America, but also in general? Is it an issue that is becoming of concern in other parts as well?
What we have learned with the COVID experience, the COVID vaccination experience, and I'll get back to measles in a bit of a time. So, what we have learned from very extensive studies on political affiliations and political signaling and political cues that people read, certainly it has a significant bearing on vaccine acceptance, vaccine hesitancy, etc. That's one. Second, in the COVID context, there have been a number of studies and very well designed studies which have evaluated a number of parameters and examined data at the county level, and there are 3,000 plus counties in the whole USA. And what the studies definitely indicate is that the political signaling has a pretty important bearing on the vaccine confidence. And therefore, what one hears both from, and here is a tricky thing, there can be some kind of signaling from the political elite, the elite leadership, I mean, and there can be a somewhat different kind of signaling from the more frontline politicians or grassroots politicians, or what's often called the last mile politicians. So both have to be factored in. And when it comes from the health secretary, which is the health ministerial level, that constitutes the highest form of the elite, in fact. So vaccine confidence, therefore, in theoretical terms, or in the theoretical understanding, it's not just a trust in the effectiveness and safety of the vaccine per se, but it is also about trust in the system that delivers, which is the immunization program, as well as, and this is the WHO framing of vaccine confidence, and I say it under quotes, the perceived motivations of policymakers making decisions on the vaccine. So it's not just what's said or what's written. In fact, he wrote an op-ed a couple of days back, but the perceived motivations as is interpreted by the recipient communities or parents in this case, all of this has a very important bearing on vaccine confidence. But that apart, the other general problem, and it's not about a person or a party or a political position, that vaccine complacency, which is not exactly the other side of the coin of vaccine confidence, that comes in when you have perceived risks of the disease in question being low. And vaccination, therefore, is not deemed a very essential preventive action. And that's a pretty worldwide phenomenon. And to be very honest, the vaccination coverage in the US, and it's true of many parts of many countries of the world, have actually been on the somewhat decline, and sustaining the vaccination coverage is a pretty challenging task. And therefore, what we see in the case of the US outbreaks, or particularly the Texas outbreaks as we speak, is a culmination of these several things. But to get back to the original point, yes, what is signaled by the political leadership, particularly the political elite, certainly has an extremely strong bearing.
So, what is happening is that because vaccine coverage was very high in the past, and you had fewer and fewer and fewer outbreaks of these infectious diseases, people became, as you said, complacent, and then they didn't think that vaccines were as important as they actually are?
That is correct. So the tricky thing about vaccination programs is that you can become a victim of your success, paradoxically. So one of the very sensitive indicators that you get from the US is what's known as the exemption figures or exemption rates. So in the US schooling system, there's a requirement of immunization, which of course would vary from state to state, or it may vary from city council to city council. Be that as it may, there's a broad schedule to be followed, but also there's a system of what's called exemptions. And you can seek, as parents, you can seek exemptions. Now, by and large, across almost all states, there is an increase in this exemption year on year over the last few years. And it may be as low as zero point 0.2 and in that range, or it may be as high as 1.3, say in Dakota, or nearly 1.5 in Nevada, and so on. Of course, there are pretty wide state variations, but this is a very sensitive indicator that the US tracks of what proportion of people are asking for exemption. And this exemption year on year has been somewhat on the rise. And of course, you have this exemption available by vaccines also, and that includes the measles vaccine also.
We spoke about the political leadership and how important it was for them to signal trust in vaccines. But is there also a factor of basic mistrust in big pharma, as it is known?
These are, of course, extremely personal decisions and perceptions, as we know. And therefore, as we know from the Indian context, the immunization program does really invest a lot of resources in generating and sustaining demand. In the Indian context, vaccination or the immunization program is one program which has extremely strong supply and certainly extremely strong demand, give or take some bits of variations, which is possible in such a large and diverse country. In general, vaccines have, of course, saved lives, and even a very cursory knowledge will tell you that mortality, particularly childhood mortality from many of these illnesses, have, particularly an illness such as measles, have dramatically come down. Or even diphtheria, for example, whooping cough, for example, dramatic declines in mortality. However, autism, and particularly in the US context, autism or autism spectrum disorders, as it's officially known as, there has been a number of contestations between whether there's a link between the measles or the MMR vaccine and the autism. But several of these papers, particularly the earlier ones, the early generation of these papers, have actually been retracted. And there was a time when opinions were deeply divided between whether the vaccine is safe or causes or is liable to cause autism. But that largely is a settled debate. In fact, it's not an open debate anymore. But that said, that's only in the realm of the scientists, or in the realm of science. Belief systems have their own dynamics, and of course, as we were discussing earlier, it does have overlaps with political or the politicians' framing of it. Politics is very central to health. That's something we should never forget or underplay, and therefore some of this still lingers, some of these doubts still linger. But what is also pretty crucial in the US context, and this comes from a number of studies which has examined the linkages between political and social framing of belief systems in medicines, of particularly vaccines. is that more conservative education and a more liberal education does have a bearing on vaccine acceptance or vaccine confidence. So we have pretty reliable evidence that the vaccine confidence is shaped by many of these seemingly not so tangible factors, but particularly in a context where COVID vaccination was so closely mapped and tracked, many of these now have far cogent evidence than was thought earlier.
Moving on to the situation in India, Doctor, you touched upon it in your answer a few minutes ago. But what is the scenario with regard to measles vaccination? Here are numbers as high as they should be. And what is the scenario with regard to outbreaks in India?
So, as far as the Indian situation goes, India is located in the Southeast Asian region of the WHO, and currently, India is part of the WHO's Southeast Asia region measles rubella elimination target. And therefore, it's a program which is highly monitored, which has a lot of inputs going into it, both into measles vaccination as well as pursuing the measles rubella elimination target. And therefore, if you see it in a slightly longer term perspective of about 10 years or so, so initially, as the surveillance system in India improved and grew stronger, we were actually picking up, diagnosing more and more measles cases, as well as more and more measles outbreaks. That happens when any surveillance system gets stronger. So we had a somewhat of a routine surveillance, obviously, but when you have a surveillance program or a surveillance component in an elimination program such as this, obviously you undertake training, you put in more diagnostic means, you collect more samples. It moves from hospital settings to more frontline health worker settings. So all of these components put together led to more measles cases being diagnosed, more outbreaks being picked up. And to us, that's good news that the surveillance system is sensitive, and that's very important for us. And then, of course, measles cases have certainly started declining. What's happened, particularly in the Indian context, and that's what really made news in 2022, is that there was a backslide. And again, this is global. There was a backslide in immunization coverage because of the COVID pandemic, not because of the COVID vaccination so much, but because of the COVID pandemic in general for these 2 years. And what we see today, even in the US context, one has to understand that it's coming on top of that COVID backslide. And therefore, in India, in the Indian story, there are two things to keep in mind. One is that in 2022, India actually reported the highest number of measles outbreaks in the world. And much of this epicenter was around Mumbai, and measles typically tends to occur in large cities, in underprivileged sections of large cities. So it's no surprise that Mumbai or Maharashtra, which is a highly urbanized state, was picking up most of the outbreaks. So on the one hand, these outbreaks were picked up, which certainly is undesirable, but one has to see it in the context of the pandemic. But the Indian response or the outbreak management has been of a very high order. The program and all three levels of government, the local government, the state government, and the central or the federal government, they have acted in tandem, and India quickly got a very quick handle on the situation. What India has also done well is between 2021 and 2022, actually India was able to halt the backslide compared to several other countries in the world, and these are borne out by the global reports and global statistics. India was able to halt that backslide and sort of put it back on keel. So India actually recovered in the immunization context, the immunization coverage context, much faster than many other countries in the world. But of course, because a pool of unimmunized or under-immunized children had accumulated over 2021. In those cohorts, we witnessed this epidemic in 2022. What is also significant in the Indian story, as far as the measles rubella elimination program goes, is that the surveillance system actually got stronger, or I wouldn't say got stronger, but India was able to carry on with the strengthening component of the surveillance even through the pandemic by using remote means of training, remote means of surveillance, etc. And therefore, though in purely vaccination coverage terms there was a backslide, but the program has got stronger. Of course, regionally, the milestone, the elimination milestone was missed. It has been reset, and there is still quite a journey to pursue. But despite these very complicated contexts, India did manage to do pretty well overall in immunization terms and specifically in the measles context.
That's a very clear picture. Thank you, Doctor. One more question with regard to mumps. There have been reports of a few outbreaks, particularly in the south, in Tamil Nadu and Kerala, that have reported cases of mumps rising for the past few years. What is the situation with regard to the mumps vaccine and the universal immunization program? And is there a case for it to come through?
There are two questions actually. Mumps, of course, there have been outbreaks through 2023 also, and a lot of what is notified may only be the proverbial tip of the iceberg, because there isn't a very active surveillance component for mumps. However, there is no case yet for the universal vaccination of mumps in India. Though, with the increasing strength of the integrated disease surveillance program across states, more and more outbreaks will certainly go on to being identified. And therefore, overall, one can certainly reasonably say that more and more mumps cases are being picked up, are being diagnosed, and therefore there is often a case made for whether mumps vaccination should be introduced. And the proponents of that thesis argue that the absence of mumps in the universal immunization program or the routine immunization program is not really, one sort of needs to think beyond that. However, the situation in states such as Kerala and Tamil Nadu are somewhat distinct, in the sense that, just as in Maharashtra, Kerala and Tamil Nadu are very highly urbanized states. Often these urbanization also is not just big towns or big cities, but a very large proportion of population actually being in peri-urban settings. And that's true both of Tamil Nadu and Kerala. And this has been noted since the last 10 years with large-scale survey data such as the National Family Health Survey or the earlier district household level survey, that the peri-urban areas are particularly weak points in the whole immunization chain. And that's something, though it has been known and been even published in journals since the 2013, 2014, 2015, that period, there have been efforts within among some of these highly urbanized states. But in 2022, very formally, the immunization program has taken up strengthening the urban component. But that may not be so easy to overcome because of certain very, very unique challenges of urban health systems. And the National Urban Health Mission is still really yet to bloom, in the sense the way the National Rural Health Mission did gather momentum over time. So these urban peri-urban challenges are going to stay for some foreseeable time, and therefore these states do need to have very special strategies. It's not that they aren't cognizant of that. Certainly, efforts are being made. There is certainly hope that when the National Family Health Service 6 results are available, we hope to see some of these actually being corrected. I mean, the evidence of it being corrected will be visible, but we'll have to wait for that a bit.
Thank you so much for speaking to us today, Doctor.
Thank you for having this conversation.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.